All right. Good evening and welcome to another Digi seminar brought to you by De Filipinske Hjelpesamfund i Norge, FHS, or FHS. My name is Renz and I'm an FHS volunteer and part of Team Newbie in Norway. Together with me is Lorraine, a fellow FHS volunteer.
Thanks for the introduction, Sekrans, and hello to our viewers. For those who are new to this seminar, FHS is a non-governmental organization that supports migrant communities in Norway by promoting awareness, education, and integration. Today's topic is a very personal and often misunderstood issue, living with HIV in Norway. This session aims to inform, break stigma, and remind everyone that HIV is not a barrier to a living, normal, fulfilling life, either as someone living with the virus or as someone close to them.
That's right, Lorraine. And this evening, we'll be joined by a resource person who will talk about the experience of people at risk of or living with HIV in Norway. We'll have topics such as access to healthcare, discrimination, and of course, how to get support. We'll also ask her some questions we have gathered from the Filipino and FHS community. But first, what is HIV? HIV, or human immunodeficiency virus, affects the immune system. Without treatment, it can lead to AIDS. But thanks to medical advances, people living with HIV can now live long, healthy, and full lives. It's important for all of us, family, friends, and communities to understand what it means to support someone who lives with HIV.
Yes, and here in Norway, we're lucky. Treatment is available. Rights are protected, and various institutions and organizations like the one we are partnering with today provide ongoing support and education. I'm looking forward to hearing from our resource person today before we start. We invite you to make this seminar interactive and connected. You can show your support or write questions you may have regarding the topic today. We request your respect and open-mindedness in today's discussion. Trolling or hate speech will not be tolerated.
I personally look forward to a productive discussion this evening. So, to help us understand more about our topic today, we've invited a guest from HivNorge. So, let's learn more about HivNorge. Yes.
Yes.
So, HivNorge is an organization committed to safeguarding the rights of people affected by HIV and works to reduce the spread of HIV and AIDS. They offer individual counseling and guidance to people directly affected by HIV or AIDS, particularly concerning rights in healthcare, social security, and workplace matters. This evening, we are joined by Evgenia Koroltseva, an advisor at HIV Norge. So let's welcome her on stage. All right.
Hi.
Welcome. Welcome, Evgenia. Thank you for joining us this evening.
Thank you. Thank you for invitation and cooperation. I'm very much happy to be with you this evening with the Philippines Hjelpesamfund her i Norge, or the Philippine Helping Society here in Norway, doing incredible work and reaching out to communities. Well, yes, I mean, you've said quite a lot already about HIV and about living with HIV. I, of course, as a representative of HIV in Norway, can say a couple of words of our organization about the work we are doing and why we are doing what we are doing today, even though a lot of decades has passed already since HIV or especially AIDS was a kind of sensation and big topic. It's probably not that big today, but still we do have some activities and directions of our work, which I would like to highlight for your community as well.
Yes, actually, this is a very timely topic for the Filipino community because there's been news in the Philippines about the increasing number of confirmed HIV cases. So there has been talks about, awareness about HIV, like what is it? I think a lot of our Filipino brothers and sisters would like to know more about the HIV, because there's some
Yeah.
fear, of course, about this alarming news. So we're really eager to learn what you have to share with us today. So we'll just let
Yes.
you
Yes,
get
sure.
it.
And it could be also good to get any questions. If I understood it correctly, we can get it anonymously. So by writing, or at least you'll also deliver a couple of questions to me on beforehand. So I'll be happy to go through it as well. When it comes to HIV, of course, the access to medication, to medicine is crucial
Mhm.
in case treatment is needed. But also, prevention work has huge impact when it comes to knowledge and how to navigate in society
Mhm.
and treat this virus or diagnosis. Yeah, I do have some presentation to share, but
Yes.
yeah. So if it's okay, I could start talking shortly about HIV in Norway as such. It's a nationwide, as you told already, organization working here in Norway, even though we are not the only one organization working with people already living with HIV status or being touched by this diagnosis. Somehow it can be relatives, it can be friends, it can be communities, and so on. The picture I use, it's a bit in the darkness, but it's quite interesting, I guess, because it's a historical picture here from in Oslo, downtown. It's the first address of not HIV Norway, but the organization prior to HIV Norway called Plus. And it was like the first meeting, the first spot in Oslo for people with HIV come together. It was a hidden address. It was by giving away password in order to enter, because people would feel a kind of as a group, right? Attached group, attached in segment in our society. It's not an issue anymore. It's not the reality anymore. People living with HIV live good lives. They get a good treatment, at least here in Norway. We do have some situations, some circumstances which might hinder the better quality of life, but still comparing to what we would experience for 30, 40 years ago, it cannot be compared. The situation is much more better today. So it means that as organization, in order to protect, in order to safeguard, and to increase the quality of life people living with HIV, here in Norway, we mainly concerned about the informational work, as what I'm doing right now, like spreading information, giving away knowledge, giving away, raising awareness. We do use a lot of time and efforts in order to reach communities and to reach groups in our societies, persons which probably still cannot be closed and frightened, detached. We try to provide information in different languages at our website. Unfortunately, we do not have any, I do not Filipino language, but at least in Spanish, in English we do have. And we are trying to be quite reachable, accessible for people. We experience a lot of requests when it comes to information, so that we see that there is a need for it, right? Also internationally. Protection of rights and interests of people living with HIV is one of the crucial direction of our work, which would mean that we do have some psychosocial support, affordable, available. We have drop-ins. We have possibility to be accessed by emails and on the social media. And we have also legal aid, which is free of charge. That would basically mean that we have lawyers, legal persons working in the office and taking the cases, taking the cases to find out if there is an HIV as such, as a topic, as a diagnosis, as a fact in one's life, has to do something with that, or with this or another circumstance or situation. I'm not sure whether I use a lot of time to talking about HIV as such, but maybe shortly we could do, because what we also see somehow that HIV and AIDS are being used like mixed on each other, and it's not correct, basically, because when we're talking about the HIV, yes, it's a virus attacking the immune system of a human being, but AIDS is not treated HIV. So AIDS is much more complicated, much more serious diagnosis, and usually, very often, it's fatal one, right? While HIV, it's not the same. People would live good, ordinary, healthy lives, basically. Of course, if they have a possibility to get treatment and to have access to medicines. So that HIV is not connected to death. It's not a death sentence, as AIDS, for example, is. But these misconceptions and duality, somehow we see it there is in society. So we think it's important to highlight that there is basically a difference, and it's a huge difference. When I'm thinking that access to medication is crucial, I mean, first of all, that it's proper medication. By proper medication, we mean that a person living with HIV gets prescribed medicines here in Norway. It's free of charge. HIV treatment in Norway is free of charge. It's quite affordable. It's quite available. It basically, one would need to come to the nearest hospital. You don't have to be citizen in this country in order to get HIV treatment. It's good to have GP, like general practitioner, fastlege, we call it in Norwegian. But if in case one doesn't have, it's still possible to get an HIV treatment. If a person follows prescriptions from the infection medical department in the hospital, then I mean, no problem. You basically live a good and ordinary and healthy life. You just show up to a blood control once a year. That is what routine, that is what usual here in Norway. Usually, not usually, but in many situations, I would at least experience that it's quite be interesting and reasonable to ask people whether HIV is a result of a personal responsibility or bad behavior somehow. This is a question which still meets people in our society, and it's weird in one way, but and strange that we are talking about the so-called bad behavior somehow. But I think it's interesting and important to talk about it, because when it comes to different communities, when it comes to different cultures, when it comes to different modes of upbringing people, to rituals, whatever it might be, morals, there still somehow might exist some misconceptions, or I don't know, traditional maybe understanding of what moral is, what good behavior is, what sexual health is about, what identity is about, what the right to private life is about, all these issues which can also contribute that person, in case he or she or get an HIV, would be very much closed as a person, and in the long run it can be very not that good for physical but also mental health of a human being. So I'm very much obsessed of saying that HIV, to get HIV, to contract HIV, is absolutely never a result of some immorality or irresponsibility just because a person is bad or somehow behaved in a bad way. When it comes to medicines and follow the prescriptions one gets from their hospitals, I can say also that women with HIV, for example, they can give birth to HIV negative children without virus. But it's, of course, if women giving birth follow up their HIV treatment as they should, like taking the pills every day, follow all these prescriptions, taking the results. But no problem to give birth to children. As an organization, we have used quite a lot of years here in Norway doing our advocacy work and working with politicians in order to get milk substitute, breast milk substitute for kids. It's still recommended also by the World Health Organizations. But we were quite successful to get it possible in Norway, so that women can get it free of charge as well in our society. So we are a bit proud of this, you might say. So in general, to be short, I can say that HIV is, yes, it's a virus. It attacks our human system. It's not the same as AIDS, and it's very good and important to differentiate between these two, because AIDS also have this echo from past, like being death sentence, being something horrible, and all this stuff. HIV is a bit different, and I mean we are already living in modern societies, so we do have medicines globally. We have a lot of organizations working on in the global scale in order to get good medicines to people and get it quite available and accessible. And people who are on successful treatment, we call it successful treatment, efficient treatment. By efficient, I would mean that being showing up for blood control, blood test at the hospital, their virus load is so critical low that it's not detectable anymore. You cannot see it anymore. You cannot measure it anymore. As far as this blood test is undetectable, virus load is undetectable, HIV becomes untransmissible. It means that a person is absolutely gets no risk to any other persons, and can have relationship, can have sexual relationship, can found a family, can get children, whatever he or she might want to do with their life. So 0, undetectable, untransmissible. It's very important that people know, because I will talk about it a bit later. Self-stigma, internalized stigma. It's about self-fear. Like I'm living with a feeling that I'm a danger for other people because of my diagnosis, but it's not necessarily the reality anymore. It's not the situation anymore. And we do see that people are living good lives, long lives, and as usual, elderly people, for example, you can get some illnesses, some health conditions, which all the other elderly people would get, but it doesn't have to be connected to HIV necessarily. Shortly about the situation in Norway, I can say that it's quite stable situation here. We are talking about not that large population in our society. It's a bit more than 5,000 people totally. So like in global scale, it's a bit different situation. We can also say that almost 100%, like 98% of people we know, they are aware of their status, that they have HIV, being here in Norway, and they get an effective medical treatment. So they live their ordinary, good lives in our society, I would say. What we also know from the Public Health Institution statistics and the yearly report they would publish, that more than half of people living with HIV have a migrant background. And well, it can be an issue sometimes. As I mentioned, related to culture, related to maybe like cultural understandings and these things. So it is an issue to try to reach to minority groups, cultural minority groups, also in our society in Norway, which I think it's important work to do as well. We also see like gradually decline of diagnosis of HIV in Norway. Last year, it's only 265 person who got HIV diagnosis or knew that they're living with HIV by arriving to Norway. But most of them are still on the efficient treatment. When it comes to this percentage, 1998, 99, it's the global standard. It's from the United Nations goals, you might say. It's a goal until 2030 that more than 95% are aware of their status having HIV diagnosis and getting treatment. That's like the goal internationally. So this is the figures we are aiming at when we are working. Doing informational work, we would definitely stop by ways of HIV transmission in different settings here in Norway, being in asylum camp, being in refugee camp, being in health, also institutions, for example, like centers for elderly patients, or for ordinary publicum. We try to, again and again, both ask people in an interactive way and lecturing about the means of transmission of HIV, because I think it's crucial that people know that to begin with, HIV viruses, it's not very easy to get it, actually, as it might look like, or as it might be. Probably hear some theories about it, but it's not that easy. And it can be only, not all body fluids, as we call it, can transmit HIV virus. We can only talk about breast milk. We can only talk about vaginal fluid, rectal fluid, seed, and blood, of course. But it still have to be a huge amount of blood in order to get HIV virus. So such misunderstanding and misknowledge and misconceptions when it comes to, I don't know, shake hands, using the same cup of coffee, or drinking from the same cup, or being stuck by some insects, or giving a hug even. I do remember we got the question, can I give a hug to a person living with HIV? Yes, of course you can. Sweat on our body after running, it's not enough to get HIV anyway. And even though the person is on medical treatment, it's not even possible at all. So these misunderstandings, I think they have to go away. They have to be past time. Yes, sexual contact is the most usual way still. Most of the people would get it like this, but again, it's not that easy to get HIV virus in the body. I can say, we used to say that yes, unprotected sex relationship with a person living with HIV and not being on medicine is absolutely a risk situation, which can cause transmission of HIV virus, but not others. Kissing each other is not enough to get it. It's not possible. Even like, I don't know, different types of kissing, deep kissing, whatever. So to conclude with, basically, I can say that life with HIV, it's okay life today. We'll look at the HIV diagnosis as a chronic state of body. It's a chronic diagnosis. It's something you live. It's not going away. It's not going to leave your body, but it doesn't ruin my health anymore in the same way it used to be before medicines can come. It's very crucial to get HIV treatment, basically as soon as possible, if a person has been tested positive, for example. And to get this treatment, yes, people would get it long life, but it becomes a routine. It's not the most difficult thing to do. Here in Norway, people would get very good follow-up by hospitals. We as an organization try to build up, to support cooperation with the hospitals, at least the biggest one, which have the infectional departments, because Norway is a quite stretched country. We do know that people can stay in small remote places, in small villages, so it's not always easy to reach a big hospital. But we're trying, and it's absolutely possible to take contact with us if some person would need help in order to get to the hospital or to get in touch or what to do further and get some information. But still, even though physically, like somatic health, physical health, the situation is much, much better than it used to be, when it comes to mental health of people, this is an issue, and it can be a big issue because we still can feel stigma, experience stigma. By stigma, I mean like negative attitudes, like suspicion, maybe things like this, maybe even fear, open fear, or self-stigma, which means that we are living with HIV can be afraid of speaking up, afraid of being treated badly, right? Which in the very, very long run can also cause that people not ask for help, not ask for health, will not attend health care, which is crucial, I would say, to get. When it comes to stigma and fighting prejudices, fighting stereotypes, educate people, this is a big work to do, and that's what we are trying to do as well. That's why we are going to hospitals, and we also take up issues, take up cases legally when we do see the situations of discrimination or situations of grey discrimination. It's like you do not know exactly what has happened, but at least we are trying to find out and help people to tackle these situations. We also have activities which I can mention later. Before I do this, I would stop on wording because it's also very important for us. What kind of words we are using when we describe, when we are talking about HIV, right? So we do talk about HIV more and more today than AIDS. AIDS is going away. It's a past. It does exist. It does happen. It's very sad stories if people, at least in Norway, can be diagnosed with AIDS. It would mean that how it can happen when we have such developed healthcare. You understand? So, but still, HIV is in a word. We do say persons living with HIV, even not people, not women, not man, but persons, because of gender diversity, because of diversity in our society. We do not say HIV positive anymore. So people living with HIV, I mean, us living with HIV, it's okay. We are not describing HIV being a disease, but more like a diagnosis, more like chronic state of body, infection, you might say. And we do trying to push on effective treatment because we know that the access to medicine is so usual and spread. So there is not the risk of getting HIV so easily as we might think or we might fear. So when it comes to concrete activities we would provide as organization, as employees working in HIV Norway, we do have psychosocial, which I mentioned, and I see it happens by giving us questions, asking when it comes to HIV testing, where to go, how to get different languages. happened this and this and this. What shall I do? Situations like this, we follow up. We do have seminars. These seminars might be on different topics. It might be like more medical topic where would we invite external expertise. Sometimes we do it in English. Sometimes we do it in different, in translation into different languages. So it's absolutely possible to stay tuned and see our activity calendar and attend digitally. You don't have to show up in our office if people would not don't want to do it. Sometimes it would be something in Norwegian we call mestring seminar. That's like how to tackle this diagnosis, what to do, how to get support from others. Shall I tell? Shall I not tell? Should I tell? Am I obliged to tell? What does law saying? All this stuff, seminars like this. We do have peer-to-peer support, which means that we have people living with HIV, different ages, different gender, different cultural background, who are trained when it comes to ethical guidelines or other things in order to give a good advice. And I mean, situations can be so much different, right? It's usually it's quite a shock. For the most people, it would be a shock to get a diagnosis like this. So how to tackle this in the very early stage? It could be very legitimate and very good to get a peer-to-peer support from a person who has been already through it. Not to preach necessarily, but being in the same situation, it might help quite a lot, and we see it does. So if it's actual, people can contact us as well and ask for peer person, basically. It can be physical meetings, it can be conversation by phone, by emailing, different ways to do these things. We do also have peer therapy groups provided by psychologists and psychotherapists and sexologists. They are we have only 2 genders so far, for male and female. It's quite popular activity, I would say, and we good responses from it. And the last one I would highlight is networking for migrants, people with migrant background, because migration health issues related to the process of migration, and migration can be of different reasons. You don't have necessarily to be a refugee, right? People have different reasons why they happen to live in a new society. For many of us, Norwegian society would be quite new when it comes to cultural norms, when it comes to legal issues, when it comes to language. So we do see that coming together provides some safety and safe atmosphere and safe basement in order to speak up. And sometimes it's enough to speak up and to share, to get relieved and to feel a bit better in order to tackle everyday life. Yeah. So yes, this is Natalia with a Ukrainian background. She is a peer person in our organization. One of them. We have quite many with different geographical belongings. Well, that's pretty much it from me. I did some questions from you on beforehand. I do hope I answered of them quite many of them. But if you still have any, I would be happy to answer it. Yeah.
Yes, thank you so much, Evgenia. Is it okay if we remove the presentation so we can have like a
yes, please do.
like a Q&A? Yes, so I think that was very informative. But as you mentioned, we do have some questions for you beforehand, or that we have gathered from from the community. I guess my first question is for people who don't have a GP or a fastlegate, how can they access, testing and treatment?
Yeah, GP is an issue in Norway, right? Fastlege. It's like we used to think that we have this mechanism, so it's good to have GP. But on some reasons, yes, it's not always the situation. When it comes to HIV treatment, it's a bit special. I mean, it's still HIV is still being considered as a folkehelse, like public health issue. So it's important for a person, in order to get good treatment, to contact the nearest hospital as soon as possible.
Mm-hmm.
Basically, being no matter where you are in Norway, you have to take a call. You have to take a phone to infection department in the hospital, or to ask us which hospital am I, like, and we can guide, depends on where people happen to be here in Norway. We did have experienced calls from northern Norway, for example, like which hospital to reach and all this stuff. But yes, just to book an appointment and get a test. If you have test already, just see the doctor.
Mm-hmm.
So it's quite easy procedure.
Um,
To we do have
is it free
yes,
or I
yes,
see. I
yes.
see.
It's free of charge. You don't have to pay anything in order to see doctor in infection doctor. No, you don't have to pay.
Mm-hmm. I see. Even the test itself, it's free. Or,
Yes.
mhm,
Yes, test itself is also free, and there are different places to take HIV test.
mhm,
Of course, you can do it again via JP.
mhm,
If not in biggest hospitals, we do have information on our website where to go when you are in Bergen, Stavanger, in Tromsø. It's like the
mhm,
biggest cities in our country.
mhm,
Oslo is, of course, a bit different situation, because in addition to hospitals, we would have organizations
mhm,
providing HIV test, which is reliable and safe to take.
mhm,
We do have an organization called Helseutvalget,
mhm,
which is easy to reach. They have drop-ins.
mhm,
We have Kirkens Bymisjon, Accept, here in Oslo, providing HIV test. And we have Olafia Klinikken in Oslo, where you also don't have to have an appointment. They have drop-ins. The information is quite available on the website.
mhm.
So that's the places to take HIV test, and you don't have to pay for it now.
I see. And you also mentioned that you don't need to be a Norwegian citizen to be able to get HIV testing. So does that mean that even people with like temporary
Yes,
residence visas can get tested?
yes, absolutely. It's enough that you are physically here and need medicine, for example.
Mhm, mhm,
You don't have to be citizen. You don't have to, I do not know, to have any other papers. You can be tourist, right? You can be tourist, happen to be in Norway and forget your medicine at home. Things
yeah.
might happen. So yeah,
Mhm,
um, it's good that people know that they do not have to pay a lot of money in order to get medicine.
mhm,
Um,
mhm,
in order to get it as well. You don't have to be citizen. No, it's a universal access to HIV treatment here in Norway.
mhm. I see. That's good to hear. That's what I was kind of wondering about next as well. Like, what in case somebody forgot their medication or stuff like that. So they just need to contact maybe one of the organizations you mentioned, or like a healthcare center, and they would be able to get the PrEP or other medication.
Yes, not PrEP maybe. You mentioned PrEP, right,
Yeah,
Rents? Yeah,
yeah.
PrEP is a bit different because PrEP is more like preventive medicine. PrEP is medicine which blocks
Mm,
entrance of HIV virus into your body. It's a bit different story, I would say, because in order to get PrEP, you have to see your GP, basically.
mm,
Yeah, so
mm,
it's a bit separate. It's a preventive work. It also has been an issue here in our organization when we have been using a lot of years in order to get PrEP in Norway and available. So far, so good. It is available, but it's still it's available. It's like for everybody, but it's still, you have to be through the system. You have to explain, you have to answer questions from doctors, from your GP, what kind of lifestyle you have, why you think you need it, are you in risk group, are you risking to get HIV, why you think so, how many sexual partners you have, did you have like breakage of personal relationship, and all this stuff. So it's different, but when it comes to HIV medicines, yes, it's available. It's easy to get.
I see. Yeah. So it's interesting to learn that maybe PrEP is not that accessible because, for example, I have friends back in the Philippines who are taking PrEP daily. So maybe what if they travel to Norway, for example, how will they have access to that and stuff, things like that?
No, it's interesting question. I take it with me. Then we have to. I have to find out about it, because if you do have a prescription, or it's something about prescription, yeah, that maybe it's a bit different, I guess. But if you do not have a prescription from your home country, I think you have to go through GP system here in Norway first, in order to get.
I see. Yeah, that would also be like an interesting topic, because the legitimization of these recept or these prescriptions from other
Yeah.
countries. How do we transfer it over
Yeah.
to Norway, for example? I have a ton more questions, but I'll let Lorraine maybe ask some of hers if you have any questions.
Yeah, thank you, Secrets. Well, prior to the seminar, we gathered some questions from our community. And but before that, I would start my first question actually. How would you know if you have acquired the disease or something like that? And what are usually the symptoms of having HIV so that people would know or go to the doctor to have themselves checked already?
Yeah, thank you, Lauren. And yeah, that's also a bit typical question, I would say. Like, what are the symptoms? What if I get the symptoms? I don't know how many. What shall I be aware of? What's happening to my body? It's not like this. We do not basically talk about HIV symptoms, I would say. When it comes to testing, it's not only if you have been in so-called risk group or anything like giving away sexual sex to others, selling sex, maybe having many sexual relations. Not only, I mean, all of us can get HIV. Basically, it's not about, as I told, this morality or any kind of behavior we might attach. So everybody can have an HIV test. It's an ordinary thing to do after a while. It's like blood test. There is nothing about it. There is no fuss about it anymore, right? So we would advise if a person has had unprotected sex and is concerned, kind of, cannot get away this feeling that what if, of course, you just go and take an HIV test and live your life further. It's better to do it than not to do it, I would say. When it comes to symptoms, that's the question we get very often. But it's difficult to say. It's not like you are getting cough. Yes, people would feel after a while that they are, in case it's a HIV virus, it's a kind of bad cough or something, bad cough, cold cough. But it doesn't have to be. It's, I mean, we are getting sore throat all the time, right? During winter time or even not winter time in Norway. So I would not rely on this symptom. Just go and have a test.
Okay.
Yeah, and I do hope that after a while, for people, it will not be that stigmatizing to take HIV test. Fortunately, in Norway, we have politicians, we have some celebrities taking HIV test online, on the stage, on TV, in order to normalize it. Because I mean, we are human beings. Of course, we have sex, we have sexual relationship, we depart, we fall in love. We are human beings. It's about our health. It's about our life. It's about our responsibility to take responsibility for our own health and to get tested. Yeah, and especially if it's so easy to get a test, it's just to do it, guys.
Okay. Thank you for
Yeah.
that. There's a question here that we got. I'll start with the first one. It says here, can I get HIV by living with someone who has it?
Well, as I mentioned earlier, if a person living with HIV, if a person lives with HIV, I do hope he or she will get medical treatment. If you get a medical treatment and it's efficient medical treatment, by efficient medical treatment, we mean that the virus load is so much low that it's not seen anymore. It cannot be seen anymore in your blood. Then you have no chance to transmit HIV to another person. So yes, people can live, how do you call it in good English, normal, ordinary
Mhm.
life, to have relationship with the person living with HIV, if the person is on medical treatment, which is efficient. Absolutely no problem. Yeah, but it's also for people living with HIV, it's a huge issue because because it's about information, right? And it's about knowledge. We would feel that I cannot have sex anymore, I cannot be loved anymore. People would, he or she would look at me that and that in this sense. It's absolutely a real dilemma for some. I will not deny it, but to talk about it and to get knowledge about it, it's crucial. Yeah. When it comes to legislation in Norway, I can also mention that people are not obliged to tell that they are living with HIV. There is no obligation to do it. If I'm living with HIV and I get my medical treatment and I have, I don't know, sex, something, it's up to me whether I tell this or not. But of course, the situations are different in our life. So sometimes we will be asked, like, do you think I should tell? What shall I do? It's difficult because it's about personal choice. It's about our own choices in life, right? So I think we used to advise that in the long run, if you want to feel good mentally, to have it good with yourself, so it's better to be honest, to tell, even though especially there is not a big issue anymore. But if you do not feel to do it, you are not obliged to do it. It's nothing to fight about. Yeah. And I know this topic is a bit different here in our country from other countries, because we do have countries in our world still criminalizing HIV and putting people in jail and, stigmatizing it more and more. So civil society institutions, they do also a lot of work in other countries in order to counter attitudes like this.
Mhm.
Mm.
Do you have another question to Lorraine? I would like, yeah.
I think just one more question. Can somebody who has or someone who has HIV can work in a healthcare, in healthcare?
Yeah. Yes. Yes. I would say so. Um, Again, I mean, if I'm living with HIV and working in the healthcare, I'm on medical treatment. I'm taking my medicine, my pill every day. My blood test is so good. I'm ordinary person. It's not like I'm going around to tell my employee that I'm living with HIV, right? There is no value in this information in a way, if you understand. And it's also good to know that in Norway we have protection of private information, and health information is very strictly and very highly protected information in our society. So that everything about my health, it doesn't have to be HIV, it's also HIV, for other institutions, for other stakeholders, for other people, it's not their business. It's my story, it's my body, it's my health. Also, when it comes to working places, yes, and it's highly protected. If this confidentiality is being breached, it's very difficult situation, and it's very serious situation. It can be a legal case, and that was we are also experiencing through our work in HIV Norway, taking up cases like this, because people would happen in different situations, even in healthcare or in social services. You might send documents back and forth without, maybe even unintentionally, thinking twice, but for a person living with HIV can be quite crucial. So situations like this, we would interfere and react, and demanding slashing HIV, or reminding again and again that you have very good reasons in order to send health documents mentioning HIV like this in open space. When it comes to your question, I would say yes. I'm not, frankly speaking, I'm not sure about some professional groups, like, I don't know, being surgery or something. That would might check. But in general, yes, of course. When it comes to right to work, possibilities to work, that is also an issue we would experience, especially people with migrant background, I would say, because in different societies in our world, we still have these misconceptions that you are not supposed to work with the children, you are not supposed to work with in canteen, in kindergarten, in school even. And we did have such cases in Norway as well, back in the 80s. I can tell you that there was a legal case concerning working or not working, being a bartender, which has been won, and it was crucial back in 80s in Norway. So people, of course, can work at the places they want to work today. Yeah.
I think this is a good question, since uh, uh, some people might feel, with this diagnosis, they might feel, oh no, I might lose my job, or I might not be able to get the job if I have this diagnosis. And as you mentioned, the stigma continues, and
Yes.
this might prevent this person from living a full life.
But you remember, in Norway, where we are applying for a job, employees are not. It's not legal to ask about your health condition, right? I mean, it's up to each person to inform what you want to inform about. You cannot put up a question on the job interview. Hey, look, I don't know, you look pale. Maybe you have some diagnosis. But it's not legal. You can be sued. It can be discrimination case situation in our society. Yeah.
I see. Mm, I think the question for me is, Is is HIV testing advisable only for people at risk? Like, who should be getting tested? For me, for example, back in the
Mm.
Philippines, you could get HIV testing for free, but I had that fear that I am taking away a resource from someone who should be getting tested or something like
Mm.
that. How about here in Norway? Is that something we need to worry about? Like, is it advisable for everyone? Or
Yeah, yes, it's advisable. I told a bit earlier, if you feel, if you know that you have been in a situation which might cause HIV transmission, like unprotected sexual experience or something, then yes, we would advise to take an HIV test,
Mhm,
just to calm down, to be sure that it's not a case. It's not a
mhm,
big deal. So
mhm,
no, we do not necessarily differentiate between the so-called risk groups and not risk groups. It's also about stigmatizing the so-called risk groups because,
mhm,
as I told earlier, it's sexual health and sexual life is a part of our identity. It's a part of our everyday life. We are human beings, right? We fall in love, we have sex, we live our lives. So it's not just because you have so many sexual partners. Hey, look, you'd better take an HIV test. Well, yes, but also doesn't have to be like this.
mhm,
And HIV test is quite available, so
mhm,
it's just to take it.
mhm, mhm.
Mm.
I see. That's it's something. It's really good to hear because I guess it could be interpreted as me also having this preconception of I'm not at risk. But
Mm.
as you mentioned, we are. If you are a sexually active person, this is part of your sexual life. So you should not be, thinking, "Oh, I don't belong
Yeah.
in this group, therefore I don't need to get tested."
Yeah, but it's absolutely, I agree with you, and it's like it's a bit of maybe new way of understanding of our health, right?
Mhm,
Like our sexual health connected to mental health, to
mhm,
physical health. In old days, we differentiate, and maybe too much stress, too much impact on physical health, like oh, I have headache. But I mean, why do you have headache? I have headache because I'm not sleeping. Why I'm not sleeping? Because I'm worrying about I don't know, my unemployment or whatever. So mental health and now sexual health is coming as a big part of our life and our identity and our private life and our well-being. So we're talking about sexual health as a part of well-being and good quality of life today. So it's not that shameful anymore. It's not we are more open about it. We are more robust also in treating maybe a bit traditional ways of looking at this, and I think it's good. We have to talk about it, and we have to talk about HIV because in order to normalize, in order not to happen in again and again situations like, oh my gosh, just because you've been doing this and this, you've got an HIV. Poor you, shame on you. It's not like this anymore, fortunately, right?
mhm,
Mm.
mhm,
And we are happy about it. Basically, we have to change the way of our thinking. That's why we are talking about HIV and about that it's possible to live a good life. It's possible to have a family, to have children, and it's possible to live a long life even.
mhm, mhm.
Mm. Yeah.
Yes, so you mentioned about the stigma, and of course, we're here talking about it to help debunk the stigma.
Mm.
And uh, because, of course, there's still this feeling, or I guess people living with HIV might have this anxiety, about living
Yeah.
with HIV. Like, there's the pressure from society of them being looked at as someone who should be avoided. Maybe there's discrimination, there's health anxiety. So I guess my question is, how can we support our loved
Mm.
ones, people in our, maybe even in our workplace, who have decided to come out or to mention that they are living with HIV? How can we support the people in our lives who are living with
Yeah,
HIV?
that's absolutely important what you are talking about because, of course, for many, many reasons, for many people, it's a very big step to do in order to tell even their relatives and close family members. That's the reality for many of people living with HIV. They do experience different reactions, right? Um, Everything from like, oh my gosh, stay away, till oh my gosh, why didn't you tell me before? Like, so like good normal reactions. If you ask how to support, just be normal, just be kind, just be understandable, just be warm person, because you know that it's not that dangerous, it's not that transmissible, it's not just like catastrophic anymore. So you have a lot of knowledge now. We do have a lot of knowledge and have a lot of possibilities to give this support and protect these people, to comfort, to listen to give a hug, to say that, hey, I'm here for you. You are still part of my family, or you're my friend. You're my closest friend. And remember that sharing things together, I don't know, sharing items in everyday life, it's absolutely no reason to think that you'll get an HIV. It's not something to be to have this catastrophe feeling. That's what about like intimate and family and close relationship, I would say. In society level, it might be difficult, of course. And people would maybe not be shy, but be quite reluctant to talk about it freely. But they also have right to do it. They have right to not to talk about it if they do not want. It's personal information. But if they do, I think they deserve all our support and protection. And say, hey, look, you are incredible because you talk about it. And we do have people who are doing this. They speak up, they are visible, they are tough enough, they are robust. It can be hard, but they will show up in informational sessions like this one I'm doing with you guys, in order to show that, hey, I'm as you are. I'm not that much different, even though I'm living with this diagnosis. It's not a fuss to make fuss about it anymore. I'm normal. I'm fine. I can give you a hug. No problem. I mentioned peer-to-peer support, and it's also one way of supporting people with living with HIV, especially maybe at their very early stage when they got this diagnosis. It can be like disturbing, very much disturbing, I guess. But we also do have people we call HIV informants. These are the persons who are speaking up and showing their faces. They're also different backgrounds and giving a speech, answer questions, sharing how it might feel, how to react, and etc. etc. Yeah, how to deal with family members. I can mention a seminar we're gonna do this weekend in northern of Norway. Yeah, collecting people, inviting people with different, with migrant background, with different backgrounds when it comes to culture, geographical belonging, language, talking to all this stuff. And that's exactly the questions we are gonna go through with the help of a person living with HIV who is ready to speak up and to be very much open about it. So I do hope it's gonna be good and supportive, safe environment there.
Mm-hmm.
Yeah.
Yes, thank you so much, Evgenia. That's all of my questions for today. How about you, Tia Lorraine? Do you have any more questions?
so far it was answered by Avinia already.
Yeah.
Mhm.
So for me, I think what I've gathered from today is that first, HIV testing, it's just normal part of our healthcare
Very.
process. It should be a normal part of our healthcare process. And, what really stuck to me was, as you mentioned, undetectable equals untransmissible. So therefore, getting treatment is the most important
Yes.
in this sense.
Very good.
Yes.
Yes.
Yeah. And
And yeah, so for us as a society, we should, destigmatize, getting tested and getting treatment, because in that way, this is how we can, help limit the spread of HIV/AIDS in the community. I think
Yes,
that's what
exactly.
I've
I
learned.
think having a proper mindset also and education about HIV is important.
Mhm.
So
Yeah. Yes, exactly. You concluded so good, Loren and Renz. Thank you so much. Yes, and please feel free to take a contact. I mean, we are here for you and your community, and I mean, we are living in the same society, right?
Mhm.
We have to see each other and listen to each other and show respect to each other's stories and personal choices. So
Mhm.
I do hope that people will get a bit relaxed when it comes to HIV and have some more knowledge, have more adequate attitudes if they experience it in their everyday life and not just run away or shout out as if something tsunami has happened.
Mhm. Mhm.
It's just to treat it in a calm and okay way, because it's absolutely okay to live with HIV today, thanks to
Mhm.
the medicines we have. Yeah.
Mhm. I'm really happy to hear that. Which brings me actually to our viewers. How can they support Hiv Norga and your causes? Because
Yeah,
the
that's a
work you
good
do is very
question.
important. Yeah.
Yes, that's a good question. We do appreciate if people will show up and want to be volunteers in our organization. Usually or often we would need some volunteers to be out in society, being on stands. Now we are in June, so Pride Month is approaching. Right, we have a lot of activities happening here, at least in Oslo, but also in different cities. Pride in smaller cities as well. HIV Norway, we're gonna stand with our stand in Pride Park in Oslo, which mean that some volunteers would definitely be there, and we, of course, would appreciate if more people would join us. Talk to people. We have a quiz with different questions in different languages about HIV, about HIV treatment, about HIV transmission, about life with HIV. So we try to speak up to people also in order to normalize this situation. So volunteering is one thing. I would say it's also possible to be a member of our organization. It's not that difficult to do. Um, if by membership we also can be more powerful, and our voice can be more powerful in our society when we do our advocacy work, when it comes to work with politicians and departments and ministers when it comes to PrEP, for example, availability of PrEP medicine or vaccine or any other health issues, when it comes to mental health as well. So
Mhm.
volunteering, membership, I guess are the ways to support us
Mhm.
in a good way.
Yes.
Yes.
Yes. Thank you so much again, Evgenia.
Yes.
And we hope you enjoy the rest of your evening. We'll say goodbye for now.
My pleasure. Thank you so much for invitation and cooperation. And I do hope we stay in touch.
Yes, that we will. Thank you again, Hada.
Thank
thank
you.
you.
Bye bye. Thank you.
All right. Yes.
So that was once again Ms. Avinia Kuroltseva from HivNorge. That was such a mind-opening discussion about a topic that carries a lot of weight to it. To all our viewers, remember supporting someone with HIV because HIV begins with compassion and education. Let's be a society that accepts and understands and uplifts.
Agreed 100% with that statement, Lorraine. And we'd like to thank our community members for sending their questions for our guest today. And of course, Hiv Norge for being a part of this important conversation. For FHS, we will continue organizing these digi seminars to bring knowledge and connection to our community. So please don't hesitate to contact us. And to learn more about our work, please follow us on Facebook and visit fhsnorge.org.
And if you or someone you love is living with HIV, you are not alone. Norway has resources and FHS is here to support you. Again, this is Lorraine.
And I'm Renz, wishing you
Safety, health, and understanding. See you
thank
at our next Digi Seminar.
see you everybody. Have a
Thank you.
good evening. Hada.
Have a pleasant evening, everyone.